So as you know, 3.5 years ago, Blair and I and Julie, along with Sherry Cannell, developed a strategic plan to become an invaluable partner to families, to sponsors, and to the HSG membership. And as part of that strategic plan, we developed 3 initiatives for each one of those 3 stakeholders. And we'll take you a little bit through some of the highlights of our efforts over the last 3.5 years, beginning with families. So for families, we wanted to investigate new therapies for Huntington's disease, expand the pipeline of therapeutics, and investigate, communicate, and educate about HD research and care. So thanks to many people in this room, we now have the second FDA-approved compound for Huntington's disease. And the amount of time and effort and persistence and patience it takes to get a drug across the finish line is enormous. As many of you know, it takes 8 years from the time that a drug enters the clinic to become approved. And these are just a small list of just the sites who participate in the FIRST and ARC studies. So if you were involved in any of the studies that led to the approval of deuterated tetrabenazine, I'd like you all to stand up. So if you were at the site, if you were one of the fearless leaders like Sam Frank and Claudia Testa, if you were at the Clinical Trials and Coordination Center and evaluating, if you were the biostatistician, if you were David Oakes, if you were a research participant or a family that was involved in the study, please let's thank them for the second FDA-approved compound. So that's the second, so we're working on the third. So Vasinex has been a tremendous partner to work with. Vasinex is based in Rochester, New York. It's actually about 500 yards from the Clinical Trials and Coordination Center. And it's been a tremendous partnership with working with Vasinex in the Signal study. So first, the WOW, we enrolled 3 months ahead of schedule. So as most of you know, 82% of clinical trials enroll late. Here we enrolled 3 months ahead of schedule. We locked the database for the first cohort of the study 2 months ahead of schedule. The interim analyses have been very promising and are leading to the doubling of the size of the Signal study. There are new sites being added in the United States and in Canada, and we're extending treatment for a subset of participants. And if you want to learn more, today at 5:30, Maurice Zotterer, who is the nicest CEO you'll ever meet, and is the president of Vasinex and a former professor at the University of Rochester, former immunologist, will be talking about the clinical development of their anti-semiphorin 4D antibodies as a potential treatment for Huntington's disease. I encourage you all to attend. And special also thanks to Andy Fagan and the leadership of the study for their outstanding efforts. We're also educating families. How many people have seen these videos that are on irritability and advanced HD and juvenile HD? So these videos have now reached over 50,000 families in 40 different countries. So this was an effort led by Heather Hare and others, including Martha Nance, Mary Edmondson, Victor Sung, and Dan Clausen. And these are like 5-minute educational videos, and they've become something of a social media sensation. Martha Nance has 17,000 views. Mary Edmondson, over 10,000 views. Victor, 7,000. Dan, we're going to work on some coaching and development skills, but over 5,000 views. And I hear there's more. So just one of these was on HD and irritability, and Heather, I think, gave me the report, and these are actual views. So these reached 13,000 people. I think something like 5,000 or 8,000 actual watches of Mary Edmondson talking about Huntington's and irritability. Just to put that in perspective, that is more people than Mary Edmondson will see in her entire career as a clinician. So more people have learned about irritability and Huntington's disease from Mary Edmondson by video than we'll learn about it from her seeing a lifetime worth of patients in Huntington's disease. So this is just a tremendous way to extend the reach and the expertise of everyone in this room to educate the community. We've also, thanks to Jack Griffin, the Griffin Foundation launched an initiative called HD Care Improvement Project. This involved a number of people in this room, including Sherry Cannell. Her husband, Al Cannell, was nice enough to provide his consulting expertise, Joni Steinman, Karen Anderson, and many others, and a consulting firm called PricewaterhouseCoopers. And they looked at three things. They surveyed almost 1,000 patients and caregivers affected by Huntington's disease. They interviewed social workers, clinicians, patients, community members, advocates, researchers, many people in this room, and investigated other care models for other rare diseases. And they came up with 5 principal key findings. The first is less than 30% of individuals affected by Huntington's disease receive care from experts. So less than 30% of people with HD receive care from experts. 2/3 of individuals have care needs that aren't addressed in the clinic. So a minority of people receiving care in clinics, and most of their needs are not being met in clinics. There's no major HD group that really has care as their primary mission. A suggestion that we need an online platform to deliver educational and care services to people, whoever they are, wherever they live. And there needs to be increased collaboration in the HD community to meet the needs of the people affected by this. We're going to discuss a lot more about this tomorrow from 11 to 12:15. We're going to present the findings in more detail and have a panel discussion by many of the groups who have been instrumental in leading this effort. And we hope to take many of these lessons and suggestions and apply them in our future efforts. So for sponsors, we identified 3 things that we wanted to do. The first was to develop and evaluate sensitive objective measures of Huntington's disease. And so while Carl Kiebers and Ira Schulson and many people in this room helped develop the Unified Huntington's Disease Rating Scale, which really transformed clinical research for Huntington's disease by giving us a means for assessing and measuring progression in Huntington's disease, it does have some substantial shortcomings. It has to be administered by experts, it has to be administered in clinics, it's subjective. And there are about 10 abstracts at least that are looking at imaging, looking at biological markers, looking at smartphones, looking at wearable sensors and other devices to get you objective measures of Huntington's disease. We're working to increase and expand the capabilities of our network and improve the efficiency of conducting clinical trials. So as most of you know, we have the most experience as an organization conducting high quality research studies. We were fortunate to be part of the pivotal trials that led to the first 2 and to date only FDA-approved treatments for Huntington's disease. We're the largest HD clinical research network with over 400 HD researchers at 100 research sites around the world. We have established outcome measures and a high-quality database resulting from at least 20 different clinical trials and probably 40 clinical studies involving tens of thousands of participants and tens of thousands of participant years of study. And our commitment to our sponsors, and what we'd like to make increasingly clear, and we'd like to be able to meet this commitment, is to provide expert input into protocol design and execution, to enable uniform and timely budgeting and contracts, to activate sites within 90 days of starting a study, to develop extensive outreach to facilitate study recruitment, to enable full recruitment on time or ahead of schedule, and we've done that for 2 of our most recent studies, have been either done on time or ahead of schedule, to generate high-quality data that's supported by expert biostatisticians, and to publish those results regardless of their outcome in the world's leading medical research journals, and we've done that recently in JAMA Neurology, Lancet Neurology, and many other publications. And finally, to the members, we set out to identify and develop the next generation of investigators for the HD community and for the HSG, to build and develop existing human capital, and to foster community. And we'll see how this works. So we, thanks to Ann Van Duzen and others, because this can play. Can you guys play this? Maybe. We've developed an online educational training platform for clinicians around the world. Can hear Victor Sung talking about the Huntington's disease triad, can receive CME credit, can receive CEU credits for this, all for free. So this is going to be launched next year. It will be an online training platform for clinicians of all types, neurologists, psychiatrists, internists, nurse practitioners who can learn about Huntington's disease from some of the world's experts here in this room. And it'll be, again, free, and you can earn CME and CEU credits. We've also launched last year 2 seed funding projects. So this is giving $10,000 to an HSG investigator. At least one goes to an HSG investigator or an HD researcher to start your research project. So you can use this for biostatistical support. You can use it to conduct a pilot study. You can use it for specimens. Last year, Dr. Andy McGarry and Lori Quinn received a seed funding grants. Andy's looking at biomarkers de-searing and is planning to apply for an RO3, and Lori Quinn is looking at exercise as an intervention in Huntington's disease and will be applying for an RO1 based on this work. We're going to fund it again, 2 seed projects. If you haven't picked up a flyer, please do so. We'd love to have your applications, and they'll be due January 15th of next year. We're fostering a great community, so there's pictures. This is a picture from last year. We'll have the pictures again today at 8:30. So in closing, over the past 3.5 years, we, everyone in this room and those who can't join us today, have made Huntington's disease an increasingly treatable condition. Thanks to you, we now have the second symptomatic treatment for Huntington's disease. Thanks to the Griffin Foundation, we've trained hundreds of clinicians who likely have cared for thousands of individuals affected by HD. And thanks to Martha, Mary, Victor, and Dan's talents, we've educated tens of thousands of families. However, the best is yet to come. Together, we are poised to find the first disease-modifying treatment for HD, and we think we can do this in the near term. So if you are Teva or Roche, Ionis or Noritis, Wave or Spark, Voyager or Unicure, Intracellular, or simply a scientist with a promising treatment, the HSG stands ready to help you bring that treatment to the clinic quickly, efficiently, and safely. With the great teachers in this room, we can train not hundreds of clinicians, but thousands. Neurologists, nurses, psychiatrists, psychologists, therapists, genetic counselors, social workers, and countless others can and should benefit from your expertise and talents. Finally, we can educate hundreds of thousands of families, and we can do so not only in English, but also in Francais, auf Deutsch, in Espanol, or any language. All of these efforts are aimed at enabling anyone, anywhere to learn about their condition, to receive appropriate care, and ultimately to access treatments that prevent the onset and arrest the progression of HD. As my term closes, I first want to thank Dr. Ira Schulson, who in 1993 created this great organization, for preparing me and encouraging me to help lead it. I could not have asked for a better mentor or example to follow. Second, I want to thank all of you, coordinators, investigators, site staff, working groups, project managers, the CTCC, Blair, Julie, Joni, the HSG Executive Committee, researchers, advocates, philanthropists, volunteers, industry leaders, families, and research participants for your amazing support and efforts. We've accomplished much together. Third, I give special thanks to the amazing, remarkable, indispensable, irreplaceable, and simply outstanding HSG staff. Steven Ramirez, Heather Hare, Ann Van Duzen, Christian Stratton, and especially Sherry Cannell, have helped convert the HSG from a small unit of a university into an independent, robust clinical research network that is transforming HD. Finally, I look forward to Houston. Next year, when the HSG's new chair and co-chair will write our organization's next chapter as we celebrate our 25th anniversary of seeking and finding treatments that make a difference.